Hello friends, welcome to the channel Dewdear Academy. In this video I am discussing the question paper, that is Sree Chitra Institute for Medical Sciences and Technology, Staff Nurse 2010 question paper. So this is the part 2 of the question paper discussion. So I have already uploaded part 1 video. So please watch it, and this is the part 2. Here I have included the remaining 10 questions, that is from 11 to 20. So the first question is, which nursing organization was the first international organization of women nurses? Options are International Council of Nurses, ICN, then American Nurses Association, ANA, the National League for Nursing, NLN, the National Student Nurses Association, that is NSNA. So which nursing organization was the first international organization of women nurses? So question is, which was the first international organization? That is the question. So here the International Council of Nurses, that is ICN, International Council of Nurses, was the first international organization for nurses or women nurses. The first international organization is International Council of Nurses or ICN. So option A is the correct answer. Then question number 12. Total parenteral nutrition, TPN, is administered through a central vein because of. Options are rapid rate of infusion, high volume of infusion, high osmolarity of solution, easy access. So TPN is administered through central vein. What is the reason TPN is administered through central vein? So it is due to the high osmolarity of the solution. It is due to high osmolarity of the solution. It is administered through central vein. So option C is the correct answer here. Then question number 13. Gas gangrene is caused by. Options are Clostridium tetani, Clostridium perfringens, then Clostridium difficile and anaerobic streptococci. Gas gangrene is caused by Clostridium tetani, then Clostridium perfringens, then Clostridium difficile, anaerobic streptococci. So correct answer is option B, that is Clostridium perfringens. Option B is the correct answer. Then question number 14. Most important step in avoiding wrong site surgery is. Most important step in avoiding wrong site surgery is. Options are having a checklist procedure before surgery, avoiding patients with the same name on the list, avoiding patients with the same conditions in the list, having a short operation list. The question is, what is the most important step in avoiding wrong site injury? Question is how we can avoid the wrong site injury. In order to avoid wrong site injury, what step we have to take, or which is the most important step? So here the correct answer here is having a checklist procedure before surgery. By keeping a checklist and checking it with that checklist, that is most important in order to avoid the wrong site surgery. Okay, so having a checklist procedure before surgery is the most important step. It is not that by avoiding patients with the same name on the list, or avoiding patients with the same conditions in the list, or keeping a short operation list. These are not the steps, but it can be done correctly. In order to avoid the wrong site injury, we have to keep a checklist procedure before surgery. So option A is the correct answer. Question number 15. Transmission of HIV to healthcare workers during surgery can be prevented by. Options are routine screening of all patients, using universal precautions, avoiding surgery on HIV patients, antiretroviral prophylaxis for the healthcare workers. So the question is how we can prevent the transmission of HIV to healthcare workers during surgery. During the time of surgery, how we can prevent the transmission of HIV to the healthcare workers. So whether it is by routine screening of all patients, or whether by using universal precautions, then avoiding surgery on HIV patients, or by using antiretroviral prophylaxis. So the correct answer here is option B, that is using universal precautions. By using the universal precautions, the transmission of HIV can be prevented to the healthcare workers during the surgery. So the correct answer here is using the universal precautions. It is not possible to avoid surgery on HIV patients or giving antiretroviral therapy for the healthcare workers. Even if we are doing the routine screening for the patients, the best and most important thing is use the universal precautions in order to prevent the transmission of HIV while surgery, when performing the surgery and all. Then question number 16. Accurate estimation of large burn areas is done by. Options are rule of 9, patient hand approximated to 1% total burn surface area, then Lund and Browder chart, calculation of body mass index. So which is the accurate estimation of large burn areas? So by using this Lund and Browder chart, Lund and Browder chart is the most accurate way of estimating the large burn areas. Correct answer is option C, that is Lund and Browder chart. It is by using the Lund and Browder chart, we can have an accurate estimation of large burn areas. Then question number 17. Most common topical treatment used for burn wound which is effective against both Pseudomonas and MRSA is. So question is, which is the most common topical treatment used for burn wound, for burns, which is the most common topical treatment, and that is also effective against Pseudomonas and MRSA. Options are silver sulfadiazine 0.5%, silver nitrate, then mefenide acetate and soframycin. So here the correct answer is silver sulfadiazine. Option A is the correct answer. Using silver sulfadiazine, it is the most common topical treatment used for burns. Silver sulfadiazine is the most common topical treatment used for burn wound. Then question number 18. Best and easy way to monitor resuscitation in a burn patient is. Options are monitoring pulse rate, monitoring BP, monitoring urine output, monitoring hematocrit. So what is the best and easy way to monitor resuscitation in a burn patient? So the best and easy way to monitor the resuscitation required for a burns patient is by assessing the urinary output. So option C is the correct answer. Monitoring urinary output is the correct answer here. So that is also an important question. In order to assess for the burns patient how much is the resuscitation required, that is mainly based on assessing the urine output of the patient. Then question number 19. Lucid interval is seen in. Options are intracerebral hemorrhage, extradural hemorrhage, acute subdural hemorrhage, chronic subdural hemorrhage. So lucid interval is seen in. Correct answer is extradural hemorrhage. Option B is the correct answer. Extradural hemorrhage. So among all this hemorrhage, this is also a very important topic for the examination. Mainly it is coming in the neurology, so it is important. So in extradural hemorrhage, we can this lucid interval is found in extradural hemorrhage. Then question number 20. All of the following suture materials are absorbable except. Options are polyglycolic acid or Vicryl, chromic catgut, polypropylene or proline, polydioxanone or PDS. So all of the suture materials are absorbable except. So among this, which is the non-absorbable one? That is the question here. So here the correct answer is polypropylene or proline. Polypropylene or proline is the suture material which is non-absorbable, or we can say they are not absorbable. All others are absorbable except polypropylene or proline. It is non-absorbable. So option C is the correct answer here. So thank you for watching this video.